back to my channel. For those who are new, my name is Dr. Milad Hilly and I've created this channel to discuss all topics associated with health. So welcome, it's so great to have you. Please don't forget to subscribe below. So today I will be discussing anxiety, what it is, the common symptoms, what help is out there, and also touching a bit about my own personal experience with anxiety. So what is anxiety? Well, it's a common and normal emotion which most people feel. We all experience it at some point in our life, depending on the situation in which we are faced with. It is the way in which our body responds to potentially harmful or worrying triggers. The symptoms associated with anxiety are quite a few. You don't necessarily need to have all of them. You can have only a few. So these symptoms can include a fast heart rate, a thumping sensation of the heart, chest pain, nausea, headaches, having a dry mouth, breathing fast, sweating, and having a tremor. Anxiety becomes abnormal when instead of being used to avoid immediate danger, it is wrongly and inappropriately activated. When anxiety appears for no apparent reason, when there is no stressful situation, when it is out of proportion to the stressful situation. If it persists even after the stressful situation is over. If anxiety affects a person's day-to-day activities, then they may have an anxiety disorder. This is very common, affecting 1 in 20 of us. For some people, there is an identifiable cause for their anxiety. For example, multiple stressful events, whether that's moving house, having a divorce, marriage, children. For other people, it could be due to a traumatic event in their life. Others, it may be due to an imbalance in the chemicals in the brain which regulate and control mood, or an overactivity in the part of the brain which controls emotions and behavior. It can also be due to chronic health conditions, a previous history of alcohol or drug misuse, or even genetics. One way of explaining anxiety is using the cup of water analogy. Here I have a cup of water. If you were to look at this cup of water and see this water level, and imagine that's someone's stress level. Now, different people will have different stress levels, and every time a life event happens, being it big or small, it pushes that stress level up. Exam, fight with a partner, someone's ill, work problems, car broke down, and it keeps pushing that stress level up, and eventually it can take one small thing to tip you over the edge. And there we go, the water is overflowing. In a similar way with anxiety, it can take that one last thing to tip you over the edge, however small the trigger is. This is an overwhelming fear of social situations. It's more than just being shy. People have anxiety before, during, and after social situations. It's a long-term condition which causes people to feel anxious about multiple situations and not just one specific event. People with this form of anxiety tend to feel anxious on most days. This is when someone has a phobia from something, which is an overwhelming and debilitating fear or dread from a situation or an object which leads to them trying to avoid it. PTSD usually follows a traumatic life event, being it an assault or a serious accident. People with PTSD tend to have flashbacks about the trauma. They'll do their best to avoid anything which might trigger thoughts about it. This is when someone regularly has sudden attacks of panic or fear. So, what help is out there? Well, treatment can really help control anxiety levels. There will be times when anxiety will be heightened depending on the situation, but treatment can really make a difference. An important way of treating anxiety is self-help measures, that is, relaxation techniques, exercises, reducing alcohol and caffeine intake, and stopping smoking. There are great resources out there, such as NHS recommended apps, which help people combat anxiety through mindfulness. I will tag a link down below which sends you to all those recommended apps, so do check it out. There are also charities such as Mind, who provide advice and support to empower people with mental health problems. I'm going to put their details down below, so check them out. I think they're great. Another great treatment option for anxiety is psychological therapies, such as cognitive behavioural therapy, also known as CBT. This is excellent as it helps a person suffering with anxiety change the way they think and behave about a situation. In the United Kingdom, you can now self-refer for psychological therapies. I'm going to put a link down below which will help you find what's local to your area. If you are struggling with anxiety, then please do seek the help of your doctor, because as well as the treatment options which I have mentioned, there are also medications which are appropriate for some people, helping treat low mood and anxiety. So please do not suffer alone. Your doctor is here to help you as well. So as I mentioned in the start, I'm going to end this video by openly sharing about my personal journey with anxiety. Those of you who followed my cancer journey through my blog, Listen to Your Body, I'll tag that down below, will know that despite remaining as positive as I could throughout the journey, there were times when I really did struggle. And I did have panic attacks when it came to having chemotherapy, and it got so bad that towards the end I would get panic attacks just from entering the hospital. And for me as a doctor, that was a real struggle, because actually being in a hospital was the natural, normal environment for me. It's where I worked, it's where I enjoyed doing everything, and actually because of the amount of chemotherapy I had and the side effects that I developed, just entering a hospital meant my heart was racing, I would feel really nauseous and sick, and at times I would throw up even though I haven't had any chemotherapy at the point. It did get really bad towards the end, towards the time when I was having my transplant, so much so that I did go on a medication which was just a tablet which I took before every chemotherapy session, about an hour before, to try and help calm me down. Did it work? I'm not sure it quite did, because I feel my anxiety levels were quite heightened. I had fear of the possible side effects I would get from chemotherapy, and I did struggle at the time. I did also have some therapy which was provided by Macmillan, which was great, and I did pull through. Thankfully, I no longer really have any panic attacks when I do enter hospitals, and I'm working and I'm doing great. But I did struggle at the time. A lot of people will suffer from anxiety, and there's nothing to be ashamed of. I do want to just come on here and tell people, yes, I've kind of gone on and given a bit of a lecture about anxiety, and I hope it was useful, but really, bottom line, my message is that don't suffer alone. Anyone can experience anxiety. No one's bulletproof. It can happen to any one of us, and yes, mine was related to my health. Yes, it was difficult at times, but here I am on the other side. I got help. I needed a combination of medication and therapy, but I'm on the other side now and I'm doing great. So if I can help one person, then I would have done my job. Please don't suffer alone. I hope you found this video informative. I hope I haven't bored you too much. So I will put some links down below with some information from the NHS about anxiety, some useful links. I hope you've enjoyed watching this video. Thank you so much for watching. So much positive energy and love from me to you all. Lots of love. Take care and bye till next time.